Hi, my name is Armando. I'm going to be your nurse today. I'm going to be doing a quick assessment on your head and neck and your skin, nails, and hair. So I'm going to start with a couple of questions. All right. So have you had any changes in your skin in the last couple months?
Nope.
Any new moles or spots in your skin that you've noticed?
Nope.
What about your hair? Anything different with your hair? Losing more hair than normal?
No.
Okay. Have you been in the sun often? You go tanning?
No.
Okay. What about your vision? Has your vision changed recently at all?
Mm-mm.
Okay. What about your smell? Can you smell okay?
Yes.
Any problems breathing through your nose?
No.
Okay. And your ear? Your hearing okay?
Yes.
No problems. No inflammation, no pain in your ear?
No.
All right. Any sores or ulcers in your mouth that you've noticed?
No.
No problems swallowing?
No.
Okay. Any problems with your head? Any concussions or head injuries recently?
No.
No lesions on your scalp? Any dandruff or
No.
any lice?
No.
No. Okay. Good. What about your nails? Any problems with your nails recently, like clubbing of the nails? Any like new lines on your nails? New spots?
No.
Chipping of your nails more often? Okay. You said no to any new moles, right?
Right.
Okay. And what about any lumps in your neck? Feel any of lumps in your lymph nodes area?
No.
No. Okay. And your thyroid? No swelling there. No pain or inflammation.
Nope.
Okay. Good. So now we're going to start with your assessment. I'm going to take a look at your hair and your face and your eyes and everything, making sure everything looks normal. I'm going to start with your head. I'm going to move down to your eyes, your ears, your nose, and your mouth. Then looking at your neck, and then I'm going to move to your skin and nails.
Okay.
All right, I'm just going to start off by inspecting your scalp and your head. All right. I'm going to take a look. I'm going to look at your hair. I'm going to feel your hair for texture. I'm looking at the color of your hair. I'm going to check your scalp for any lesions, any dandruff, any lice in your scalp. I'm going to feel the back of your scalp. I'm going to feel the contours of your skull, feeling the occipital back there, feeling the top of your scalp. All right, everything looks normal. All right. So next I'm going to move down to your eyes, okay?
Yeah, okay.
I'm going to look at your eyebrows, your eyelashes, and your eyes, looking for any discharge coming from your eyes, and looking at the symmetry. Mind taking off the glasses? All right, I'm looking at the sclera of your eyes, making sure they're nice and white. All right, I'm going to pull down on your eye, looking at the conjunctiva, nice and pink. Do it on the other side. Okay. And then I'm going to come in with the pen light, looking at your pupil, making sure it's reacting to light, and do the same on the other side. Around, making sure we have the consensual reaction, making sure if it constricts on the right side that it constricts on the left side as well. All right. Next, I'm going to test for your peripheral field of view.
Mm-hmm.
So I'm going to come in with my two fingers here, and you're going to stay right in my eyes, and then you're going to tell me when you see my fingers in your peripheral view, okay?
Mm-hmm. Yes. Yes.
Okay. Next, we're going to do the 6 cardinal views of gaze. You're going to stare at my finger. I'm going to start in midline, and then I'm going to go right midline, up, down, then left midline, up, down. Just stare directly at my finger.
Okay.
All right. All right, now stare directly at my finger, and then look at an object behind my finger. All right, so I'm just checking for your pupil constriction, making sure everything's okay. Everything looks good there. Now I'm going to check do a fundoscopic exam, looking for your red reflex in both your eyes. So I'm going to use my left eye and look in your left eye, and then do the same on the other side. Okay. All right, everything looks good. I'm going to move on to looking at your ears, okay? Looking any discharge coming from your ears, any abnormalities that I notice. Just inspecting first on both sides. All right, now I'm just going to look into your external canal, just looking. All right, so I'm going to do a little tug test and tell me if you have any pain, okay?
No.
All right, on the other side.
No.
All right. Now I'm going to look into your ear. I'm going to pull up and back. Okay, do the same on the other side. Okay, I'm looking at bony prominence inside your ear, making sure they're nice and white, no redness that'll indicate inflammation or infection. All right, we'd also do the whisper test. I'm going to clue one of your ears. I'm going to say a 2-syllable word. You're going to repeat it back to me. Apple.
Apple.
Okay.
Banana.
All right, perfect. All right, next I'm going to move on to your nose. I'm going to take a look at the outside of your nose, looking for symmetry, looking for any discharge from your nose, any redness. All right, I'm going to have you tilt your head back and look inside your nose. Okay, looking at the mucosa, looking at the septum. All right, everything looks good. All right, I'm going to move down to your mouth. I'm looking at the symmetry of your mouth, looking for any lesions on your lips. All right, I'm going to have you open up your mouth and say, ah. So that helps open up the throat so I can see your tonsils back there. So you look at your uvula, open up again, looking at your hard and soft palate, looking at your dentition, looking at your mucosa of your tongue. Okay. All right, next I move down to your neck. Okay. I'm feeling for all your lymph nodes. I'm going to feel for your lymph nodes in your neck and all that. And then I'm going to look at your trachea and your thyroid and make sure everything's okay there.
Okay.
So first I'm going to feel for your preauricular, before the ear, so right in front of your ears. And then behind your ears. For your postauricular. Moving down to your tonsillar, submandibular, and your submental. I'm going to feel for your anterior cervical and your posterior cervical. And then I'm going to have you turn your head that way. And I feel for turn your head towards me, for your deep cervical. Okay. And then I'm going to feel for your superior clavicular, so right above the clavicle. Same on the other side. And then your inferior clavicular. Okay. I'm also going to feel for your sinuses now. Feel your frontal sinus and your maxillary sinuses, and then I'm going to feel for your TMJ, your temporal mandibular joint. Any pain there? What about here?
No.
All right, I'm going to have you open and close your mouth. Okay. All right, now I'm going to move on to your nails. I'm going to look at your...
You didn't let me swallow.
Oh, yes, that's right. I'm going to look at your trachea and your thyroid. I'm going to have you tilt your head up. I'm looking for your trachea, making sure it's midline. And then I'm going to feel for your cricoid cartilage. I'm going to displace your trachea first, right and left. All right, I'm going to feel for your thyroid. Put your head down again. All right, can you swallow? Okay. All right, now I'm going to move on to your nails. So I'm going to be looking at your nail beds, your lunula, the cuticles, and the free edge. Making sure you don't see any clubbing. I'm going to check for your capillary refill, making sure it's 3 seconds or less. That indicates if you're perfusing properly, which you are. Do the same on the other hand, making sure they're equal. The lunula, the cuticles, free edge, capillary refill. All right. Okay, now I'm going down to your skin exam. So I'm just going to go over your whole skin, look at your skin, make sure I don't see any new moles, anything abnormal. Looking at your skin turgor, your elasticity, looking at any visible veins. Yeah, so I'll start by looking at this side of your body, looking at your arms, your neck, your face, at your back, your legs. All right, I'm going to check for your skin turgor, your elasticity. Good. The same on the other side. Get this arm, this side of the face, the back, the neck. Check for skin turgor on this side. And then look at brachial vein if we see one. This side. And looking at your jugular veins, looking for any distension, which can indicate fluid volume overload or excess, which I don't see. And then I'm looking for edema on your lower extremities and your upper extremities, but I don't see any edema on your upper extremities. And then look at your lower extremities. No edema. And no pain when I palpate.
No.
Okay. All right. No edema. And then checking your nails and your feet as well, looking for the same capillary flow 3 seconds or less. Look at the nail beds, the lunula, cuticles, and all of that. Everything looks good. All right. I think that's it. I think we're done. Thank you.
Thank you.
Oh my God, that was so long.